Broadcasting from the business capital of the world, this is the Podcast Business News Network. Welcome back to the show. Dr. Pam Fox joining us. Excited to have her back here from beautiful Arlington, Texas. And I'm going to have her introduce herself because there's a plethora of things that she is and she does, and she's just awesome. Tell us a little bit about yourself.
All right. Well, good afternoon, Jill, and to your audience. And it's my pleasure to be here with you today. I'm Reverend Dr. Pamela Fox. I'm a licensed clinical social worker, mental health and wellness therapist, and transformational life coach. I'm in private practice here in Arlington, Texas, providing mental health care, outpatient mental health care, and life coaching services to many, many people. Fee for service is my private practice. I'm a solo entrepreneur, business owner, and just glad to be in the house today. Thank you so much.
Thank you. And we can find you at PamelaFox.net. PamelaFox.net is one of the ways we can contact you. And we're also live here on the Zoomcast. And you're from Synergy Counseling and Coaching Center as well. So there's a lot of work that you do.
Yes.
And you have a lot of areas of expertise. Which one today did you kind of want to walk down the path and enlighten our listeners with?
So in my practice at Synergy Counseling and Coaching Center in Arlington, I work with I only work with adults, but here lately I'm working with a lot of older adults. And I've done some research about the older adult population. And so I wanted to kind of focus in on that today, and specifically looking at the topic of trauma-informed mental health care with older adults. Again, that's a growing population. You may know, Jill, from some of the U.S. Census Bureau statistics that the older adult population is just growing and growing and growing. Some of the statistics indicate that in 2020, the population was about 56 million older adults, people over 65. I'm in that number, which made up of 17% of the population. But the guesstimate is that by the year 2030, there's going to be 73 million older adults, comprising 21% of the US population. And going down the road to 2060, the guesstimate is that there's going to be 94, almost 95 million older adults, people over the age of 60, 65, comprising 23% of the population. So again, this population is growing and growing and growing. And many of these older adults do have unresolved mental health and trauma issues that may come to the attention of a mental health provider such as myself. And so what I wanted to talk about today is to look at some of the impacts of trauma and some of the signs of trauma with the older adult population.
All right, we're listening. So what are some of the signs? Yeah.
Well, some of the signs, and I'm a researcher, I'm kind of nerdy by my profession. And so I really like to dive into and delve into the research. And some of the research, which I've taken from a psychologist and psychoanalyst by the name of Erik Erikson, which many of your audience may have heard of Erik Erikson, and his stages of psychosocial development. One of the stages that focuses in on the older adult population is the one called maturity, the age of maturity. And the issue going on here, or the struggle, if you will, is integrity versus despair. So by the time a person is a certain age, hopefully, prayerfully, they have resolved whatever the previous issues that went on for them in their earlier life. But sometimes that's not the case. And so some of the outcomes from this particular stage of maturity, which has to do also with Dr. Erikson talks about this life stage should bring about wisdom and maturity. And so again, the outcome of the stage ideally is a sense of life satisfaction in order to face death without despair. So again, a sense of life satisfaction and the ability to face life without despair. And many older adults are not in that place. They have chronological age, but emotionally and mentally, they're not in a good space. So with that in mind, many of the older adults are suffering from traumas of all sorts. And traumas are a person's response to something that has been very distressing in their life, whatever that might be. And the trauma may be acute, something that happened like recently, could be chronic, something that happened a long time ago, could be very complex. There's a lot of nuances to it, could be vicarious or secondary because they are a caregiver Maybe they're suffering from caregiver burnout. They may have had some very bad childhood experiences back in the day, and they may have lived in what they call adverse community environments from back in the day. And they're still dealing with the traumas that were incurred from those time frames. And so sometimes what happens with these older adults, they have all these unresolved issues inside of themselves, and they may experience as they get older and older, they lose friends, they may lose connection with other people. The recent pandemic from 2020 to 2023 did not help matters at all for older adults. So that sense of loneliness and isolation, stagnation and despair, lack of life satisfaction, etc. You're retired, you don't have a mission, so you think you don't know what to do with your time. And so they may not be able to face death without despair. So that's a big issue for a lot of seniors, older adults. Yeah. And so the question that the therapist asks, persons such as myself want to know, the question is not what's wrong with you, but what happened to you. The therapist, the provider wants to know what happened, gives the senior citizen, the older adult, an opportunity to tell their story, Perhaps they haven't had an opportunity to tell their story before. So in the counseling, in the conversation, crucial conversation, I would say, the older adult has an opportunity to tell their story, which is in many cases a story of trauma and drama in terms of what happened to them in their past. Yeah. So I just put that out there for you and for the audience to consider that this is very intriguing to me, again, as myself as an older adult. And I too, at some later point in time in some future podcasts, I will share my story, because I too am a trauma recovery survivor. And so I think that is of relevance too, in terms of how I was able to progress from where I was back in the day to where I am today. My saying in my practice is that the struggle is real, but that resilience is more real. And so as a result, my role is to inspire, as a helper healer, is to inspire my clients to reach their full and highest potential.
Beautiful. Thank you for that. And thank you for opening up with us. Looking forward to getting your background further too. And in the meantime, you're helping so many different age groups that we're talking here about. Those you mentioned over 65, right? Or 55?
Over 65, but according to the U.S. Census Bureau, over 65 older adults. But we know that the struggle is real for everybody.
Yeah.
For children, for adolescents, for young adults, because it's really difficult out here. And just out of interest in sharing with the audience, that some of the issues for the younger folks are early childhood, the issue of autonomy. I'll go back to infancy. The issue for the infants is that of trust versus mistrust. Do I trust the provider who's taking care of me? Am I going to get my bottle? Am I going to get changed? Is somebody going to come and talk to me and take care of me and hug me and love me? And for some infants, that has not been their lived experience, unfortunately. And then for some older adults, because that was not their lived experience as an infant, as an older adult, because it's like life goes full circle. You start off with baby food, you end with baby food. You start with a potty chair, you end with a potty chair. I'm just being humorous right now.
No, it's true. Yeah, we go back to where we came from the same way. Yeah.
Full circle, yes. And then the struggle of the young kids is that of being able to do their own thing, autonomy versus being ashamed. I don't know these math problems. Am I smart enough? Am I talented enough to do this, that, and the other? And so they have some struggles there. And the struggle for them is, do I have the ability? They're doubting themselves. Can I control myself? Can I exercise my gift, skills, and talents in the school setting or preschool, whatever the case may be? And so that's an issue for them. And then you get into the school age, and then they're looking at, am I good enough? Am I talented enough? And so forth and so on. And so then they have a sense of, some students, middle school students, have a sense of inferiority. And you know from what you read in the papers and what have you, social media, sad to say, there's a lot of bullying going on.
Oh yeah.
In the middle school and the high school community. And then you get to high school and adolescence, and the deal is, identity versus role confusion. Who am I?
Mm-hmm.
What am I going to be? What am I going to do when I grow up? And for the adolescents, the brain is not fully developed. And sometimes in those adolescent years, the teenager makes bad decisions because they're, dealing with impulse control. They can't
Mm-hmm.
control it, so they just do stuff. And whatever they do sometimes winds up in some bad consequences. So that's a big deal for them. Then they move into adulthood, young adulthood. The issue there is intimacy versus isolation. Who am I going to connect up with and
Mm-hmm.
have some beginning of some kind of life as a grown up, and to see what that's about. And then you get into middle age. Middle age, you're supposed to be at the top of your game and you're highly productive and so forth and so on. So the issue for the uh, in that middle age period is generativity versus stagnation. Have I done enough? Or am I kind of like stuck in my career? I'm like, what am I going to do now? I'm
Yep.
not able to retire. Uh, my kids are looking to me for leadership, but I'm kind of like confused about what I need to do going forward. So it's a big deal issue. And then they get into the maturity
Yep.
where they think everything is squared away and I'm, got this wisdom and people are looking to me. I'm sagacious. I'm a sage. I got the gray hair. And then, people are coming to them for wisdom and they're not in a good headspace themselves. So
Yeah.
they may not have a lot to share.
Oh.
So it's pretty significant. Yeah. So the other thing I would mention in reference back to the older adults is that, and for everybody, actually has to do with mental health. That's a primary area that I work in terms of my practice, in terms of mental health and wellness. And the researchers say that mental health and wellness has to do with our emotional and our psychological and our social well-being. Again, our emotional, our psychological, and our emotional well-being. Our emotions have to do with our feelings, and then our psychological well-being has to do with kind of sort of our identity. Who am I? And then our social well-being. How am I interacting with other people? So those are really important parts, I would say. But again, you factor trauma into that, those distressing events that may have happened for people, and it just complicates things a whole bunch.
And it can last with you childhood to older adulthood for sure.
Yes, yes,
Trauma
yes,
doesn't go away, right?
yes. And a lot of people, as you know, from old school people like myself, whatever happened to you, you don't talk about it. You just kind of like hold it together, keep on moving, what have you. But on the inside, you're falling apart because there's brokenness in it. And you don't know who to talk about. Because back in the day, we didn't talk about going to no counselor or going to see a therapist. That, yeah, in quote, I'm not crazy, which is not an appropriate thing to say. But some people say, that's what they were taught back in the day. You don't
Mm-hmm.
talk to people. You keep family business within the family. However traumatic that was, you don't talk to anybody about your stuff. You just kind of just hobble your way through life as best you can, sometimes being not all that you wanted to. Your life is not all that you would like for it to be because you've got brokenness on the inside.
Ah.
The
Ah.
inner child has been wounded.
Yeah.
The inner child is still broken.
Oh, my heart goes out. My goodness.
Yeah. But now you're
Ah,
65 years old and your inner child is still broken. Now what do you do?
it still could be fixed though, right,
It
Pam?
can still be fixed. Right.
Dr.
A
Pamela
lot of
Fox.
celebrities,
Yep.
the celebrities have said it's okay to not be okay. It's okay to talk to somebody.
Yep.
And so that can be a point of entry for some people. Like, oh, I'll use Oprah. Oprah said it's okay to talk to, you know, somebody. So if she said it's okay, it's okay.
It's true.
And that may be a motivator for
We
some
look
people.
up to, yeah, sometimes you look up to those in the public eye for sure.
That's
And
right.
yeah, the good, the bad, all of it we see, but it's good when you
Yes.
see someone that you
Yes.
well love, respected, adore, and say, oh, they didn't always have
Right.
this house. They
Right.
didn't always have this money.
Yes.
Oh, that happened to them. I thought their
Yes.
life was perfect.
No, no, no. And then you go back and you listen to their life story. And you find out it was absolutely not perfect.
Mm-hmm.
And it's by grace and mercy and prayer that they made it to the high levels of success that they are experiencing currently.
And I bet you most people would say, they wouldn't change a thing, right? Because that inspired them in other
That
ways.
inspired them.
Isn't that,
It
yeah.
wasn't pleasant, but it was
Mm-hmm.
a motivator. It was a catalyst for them to move forward and do the wonderful things that they're doing and giving back to the community.
Yeah.
Mhm.
Oh, thank you. All
Yeah.
right. Let's remind everyone how we contact you.
Point of contact for me is primarily through my website, which is www.pamelafox, one word, .net, and also my email address, which is Dr. Pam Fox at att.net, all lowercase letters. Again, that's Dr. Pam Fox at att.net. And for interested prospective clients, I'm offering one free 45-minute stress management consultation. That can be in person for those who are here in the DFW area, or it can be virtually. Just to give people a chance to get to know me, I get to know them to see if there's a goodness of fit between me and them in terms of their interest in either mental health therapy or transformational life coaching.
All right. Thank you so much. Let's continue. We still have time to talk more about
Right.
us older adults, right? As
Older
you put
adults,
it.
yeah, yeah. And one day, Lord willing, that we all be older adults.
I
And so
know.
this is very important to everybody, or they have older adults in their life,
True, true.
grandma, grandpa, great grandma, all of that. So this is applicable to them as well. So I'll share with you again. This is from some research that I did, some quotes from older adults, which I think your audience may find of interest, and some quotations. And this is from a research plan called the Aging Texas Well Strategic Plan, 2022 to 2023, from the Texas Department of Health and Human Services. And so some of the seniors, I shouldn't say seniors, the correct word is older adults. Some of the older adults in this research project said about trauma and mental health. With a mental health issue, it's hard to admit it to yourself, let alone to someone else. And another older adult said, when the opportunity arises, when I'm ready to admit that I need help, it is too difficult to find the right resource. So that's a true statement, because the mental health resources are not as plentiful as they need to be. The need is great, but the providers is just not enough. So there has to be some targeted effort to uh, have more interest in this subject area so that people can go to school and get the requisite degrees and licensing and all that so they can be ready to be a mental health provider. Another older adult said that when I'm depressed, I don't want to go out to see people or do anything, even if I had a way to do it. So sometimes for some older adults, the issue for them is transportation. They're kind of stuck in the house because they're not really able to drive their car anymore, or they don't want to drive the car. They don't feel safe driving their car. And maybe in their community, wherever they are, maybe it's a rural area, there's not a whole lot of transportation resource. So they wind up staying in the house, staying in the house, staying in the house, watching TV, sedentary lifestyle, waiting for somebody to bring them some food, and then they can't get out and about and be with other people. So that's an issue. And then another quote is, when I'm alone and isolated, I feel embarrassed. I feel like a failure, and like I should be able to figure a way out before it's too late. So those are some very profound quotes from some older adults who were participants in this study. And it's I think gives food for thought in terms of what we need to be thinking about in terms of services, especially mental health services to our older adults.
And what about older adults out there who may not have the means to get the help they need? What would you say to them?
There are resources out there, not as plentiful as they need to be, but there are some resources out there through various state, like Health and Human Service Commission department programs, where low cost, no cost mental health services are available. Mental health services are available for those who are on Medicare, that it is a clinically billable service, if you will, to get counseling through Medicare. Or if a person has Medicaid, a state Medicaid program, the counseling services can be made available through that resource as well. So there are resources out there. People just need to just find out how to navigate the system. Sometimes that's complicated. But there are case managers out there as well for older adults and various programs to help our older adults navigate these systems to get the help that they need. And sometimes the help is through their primary care providers, their physicians or nurse practitioners who are seeing them on a regular basis, quarterly, every other month or whatever, however frequently they go to the doctor, to the clinic. Because sometimes that's a way of accessing resources too. Because the primary care providers nowadays are doing for because of Medicare, they have to do a depression screening on all the seniors. So that's a way of trying to figure out what's wrong, what's really going on with the person.
Well, thank you so much, Dr. Pam. We still have a few minutes left, and
All right.
there's more to, I know that you help, and we're talking about a little bit of the older generation today, but
Yes,
you're,
yes.
you know, you help others in general. It doesn't matter their age, though, right? You work with people all ages.
I do. And so again, I primarily work with adults. So we're talking about
Mhm.
ages 18 to 85. I think my oldest client is 85. But the vast majority of the folks that I work with in my practice are middle-aged or older adults, and they are seeking help with navigating relationship issues or work-related issues, or they're thinking about going back to school and the stresses related to that, or just personal challenges that they are now in touch with and they want to get some resolution with those issues, whatever that might be, or some new health challenge might have come up, which is causing them a lot of stress. So those are the kind of issues that come to the forefront in terms of the work that I'm doing currently. But I would say the vast majority of my clients in my practice are dealing with some kind of trauma. And then it takes probably several sessions and months sometimes to really unpack what that trauma is about, because there's some reluctance to talking about whatever happened back in the day, because sometimes people fail to make the connection between what happened back then and how that still affects you in the here and now. And
So,
just to say a little bit more about that, the trauma, we're talking about PTSD, post-traumatic stress disorder, is a real thing, and it can happen when a person, our guidebook is for mental health people. It's called the Diagnostic and Statistical Manual for Mental Disorders. So in that book, it's like an encyclopedia. And that book speaks about PTSD, post-traumatic stress disorder, as a condition that may occur when a person is exposed to actual or threatened death, serious injury or sexual violence, and as a victim or as a witness, where there's been repeated extreme exposure to details of traumatic events. And it causes intrusive memories, it causes dreams and flashbacks, it can cause avoidant behavior, negative thoughts and mood, being highly reactive, like startle reflex, hypervigilant. You're always watching, thinking something bad's going to happen, and poor concentration and other kinds of manifestations of this. And this can result from, again, distressing things that have happened to a person. It could be direct exposure or witnessing something really bad, or indirect exposure by hearing about something, and then repeated or extreme direct exposure, meaning it happens over and over and over again. And so that's pretty significant. I'm thinking as I'm speaking on this about the first responders from back in the day during the height of the COVID era. First responders, the emergency room personnel, paramedics, fire personnel, chaplains, social workers, and others are identified as first responders. So the stories that they heard about, the things that they saw, because you can't unsee what you've seen, and so it can really impact the psyche in terms of the brain, because it's like you have a visual and auditory and smell, olfactory remembrance of what happened.
My girlfriend's an RN, and she still talks about it. It still affects her. She was at the hospital so many hours, and she describes the trucks out back of the hospital filled with dead bodies. This is like in, you know, this is on Long Island in New York, and it's like, what? She says the amount of bodies, the smell, the chaos. It's something, it's like, it's just baffling to even think about that they had some trucks that the refrigeration went down and the generators, and she's, it's like the worst memory for her, how so helpless everyone was feeling, just dying. It was like a
Yeah.
plague. It was like
Yeah.
the Titanic, she
Yeah.
describes it as,
Yeah.
but I know
Yeah.
that affects her every day. She
Yeah.
goes to work
Yeah.
still. And although
Yeah.
things are better, it's always on her mind that we never thought in this day and age
Right.
that something like that could happen.
Right. Because the last time something like that happened, I think in the US and in the world, was back in the early part of the 20th century with the flu pandemic,
Mm-hmm.
which
Yeah.
lasted a long time. Similar sort of situation, no vaccine and all of
Yeah.
that, and lots of death. And then here in the 21st century, we had something like that happen because everybody went into like the year 2020, like, oh, it's going to be great. Oh, la, la. They were so excited about 2020. And then lo and behold, here we get a public health crisis.
I mean, I remember being glued to the television every day watching our local legislator, governors, people, president talk. And it was like, what is going on? It was it's traumatizing for so many, especially those in the healthcare. But oh my goodness.
Yes. And you can imagine that a lot of the deaths were older adults.
Older adults, yes, because they had underlying conditions. I mean, horrible to relive that.
A lot of them had pre-existing conditions, diabetes, heart disease, whatever, and then they just succumbed to the virus, but they had these other health challenges going on, and they didn't make it. And that was pre-vaccine, as I recall.
Yeah. Well, thank you for being so helpful, so insightful. Thank you for diving into trauma. And I know talking about yours is not an easy thing, but we appreciate you being open, and we'll talk about that soon. And to people out there in need of help, how do we contact Reverend Dr. Pamela Fox? Remind us.
My point of contact is www.PamelaFox, one word, all lowercase letters.net. Again, that's www.PamelaFox.net. My email address is drpamfox@att.net. Again, that's Dr. Pam Fox at att.net. It's the Synergy Counseling and Coaching Center, where we're inspiring you to reach your fullest and highest potential.
Thank you so much. You have a fantastic day, and thank you for today's conversation as always. And we'll talk soon. Thanks so much.
All right. Thank you.
Everyone, stay tuned. Thank you. We'll be right back.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, I mean, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
mortgage-free, fully adaptive, handicap-accessible house. And there's no catch.
It'll be our very first home that we've ever owned. This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.